This has definitely been described in the literature at the lower dose of finasteride, which is used for male pattern baldness, the 1 milligram. And these changes that can be negatively impacting male sexual function have been reported in many men and have been reported to possibly be irreversible.
Okay, well that certainly is reason for concern. We are here on the ED Radio podcast with another episode. We are joined today by Dr. Marah Hehemann. Dr. Hehemann is an assistant professor of urology and associate program director of Andrology at the University of Washington in Seattle. Her work focuses on male sexual function and fertility, and she also practices in a clinical setting there. Today, we want to explore the impact of Minoxidil and finasteride, better known as Rogaine and Propecia, on erections and sexual function. Dr. Hehemann, thank you very much for being with us.
Hi, Mark. Thank you so much for having me. It'll be an interesting topic.
Yes, it is quite an interesting topic, and we do hear, by email comments, consults, people are asking us about both of these medications and their impact. So, Dr. Hehemann, to get us started, can you briefly explain what Rogaine is, what its primary use is, and how does it work to promote hair growth?
Yeah, so as a urologist, I will admit that I had to look this up because it's typically can be available to men over the counter or prescribed by primary care providers or dermatologists. It's not something that I regularly prescribe, but certainly it's something that my patients are regularly using, especially with the advent of so many direct-to-consumer healthcare platforms that are selling it. So my understanding is that Minoxidil was sort of launched in the 1980s when it was being used for high blood pressure, and was noted that patients using it were actually seeing return of hair growth or excessive hair growth. And, it reminds me of a similar story of a drug that was being used for another reason and was found to have a different effect, and that's Viagra. So Viagra sort of had a similar story where it was being used for pulmonary hypertension, and then it was found to improve erection. So kind of a accidental discovery of Minoxidil. And it is a vasodilator, so it helps with blood vessel dilation and blood flow, and also has some increase in cell proliferation. So it helps sort of cell turnover and cell growth. And I think that's probably, while I think the mechanism of action isn't entirely still understood, it acts at the level of the hair follicles to help with cell turnover and cell growth. So that's really my understanding about how it works.
Okay, we'll come back around to this. You mentioned it's a vasodilator, which I believe PDE5 inhibitors are also vasodilators. So we'll come back, and it just kind of sparked my curiosity about that. But I want to get to that in a couple more moments. So let's just move over for a moment to Propecia, which is like another very popular medication for hair growth. So what is its primary use, and by what mechanism does it work?
Yeah, so Propecia's generic name is finasteride. And this is one of the main drugs in the category of drugs known as 5-alpha reductase inhibitors. So 5-alpha reductase is an enzyme that is present throughout the body. And this medication class, 5-alpha reductase inhibitors, or I'll kind of refer to them as 5-ARIs, prevent this enzyme from working. And what this enzyme does is it kind of works in the hormone cascade where it prevents the conversion of testosterone into dihydrotestosterone. And so that is helping keep more testosterone around. So blocking that conversion helps keep more testosterone around and helps reduce the amount of DHT or dihydrotestosterone in the body. And this is important because dihydrotestosterone is a very powerful male androgen or male hormone that can contribute to things in the male body like hair loss, male pattern baldness, as well as things like growth of the prostate. So these are kind of two areas where this kind of medication is most commonly applied clinically. We use this medication class 5-ARIs to reduce DHT and thereby prevent things like prostate growth and male pattern baldness. And I said prevent, but also we can reverse those processes as well when we use these medications.
Okay, so it sounds like finasteride has uses outside of prevention of hair loss or promotion of hair growth. And you mentioned prostate, which certainly would fall under urology. Is this a drug that is prescribed with some frequency or commonality in the urology space?
Yeah, finasteride is definitely prescribed very commonly for BPH, or benign prostatic hyperplasia. It has sort of a, distinct role for men who have enlarged prostates and may not want to have a procedure to help with prostate related symptoms. And so we prescribe finasteride for those men. It is a different dosing strategy. So for BPH, or benign prostatic hyperplasia, we prescribe finasteride at a dose of 5 milligrams daily, whereas typical dose for male pattern baldness is 1 milligram daily. And that's what you would see more commonly on those direct-to-consumer websites that are, responsible for prescribing medications for male pattern baldness.
Okay, is it fair to assume that at the 5 milligram dosage, one who would be receptive to the impacts for hair retention, prevention of hair loss, and whatnot would also see effects if they're on that medication for BPH?
Yeah, probably. I would say it's very much less common to prescribe that high of a dose to, younger men. So I see men in their 60s, 70s who are taking finasteride at the higher dose, and, they may not care as much about male pattern baldness by that time, but certainly they may see a little added benefit.
Got it. So have there been reports of either minoxidil or finasteride impacting erectile function? And if there have been, how common is this?
So I'll just start with the minoxidil side. So I am unaware of a significant impact of minoxidil on sexual function, especially when it's used topically. So topically meaning to the skin rather than taken orally. And I think that's probably the vast majority of how it's being taken. Although again, I'm not a common prescriber, but my understanding is that it is most commonly applied topically, and that only about 1% of the medication is actually absorbed through the skin into this systemic or full body circulation. So my impression is that that sort of vasodilator effect would probably have very minimal impact on the penis. You mentioned vasodilators, or tadalafil and sildenafil, the PDE5 inhibitors, being vasodilators. So that's absolutely true. I just think that it's probably unlikely that you would see a positive impact on erectile function just because the absorption is so low.
Okay, and just to help clarify for myself and for the listeners, a topical application of a medication, is that less likely to enter the general bloodstream and have broader effects as compared to, let's say, an oral medication?
It depends on the medication. So some medications, like for instance, we use topical forms of testosterone replacement that we know are absorbed well into the system, and that's why we deliver them in that way. Just from my reading on minoxidil, I read that only about 1% of it is absorbed into the circulation, but I think it is based on how much of it is being used and how, broadly it's being applied and what percentage is being used. So there are sort of stronger formulations than others. And so the stronger the formulation, the more the absorption. But what I read is that only about a 2% preparation of minoxidil, only about 1% of it is absorbed systemically.
Okay, and for the oral medication, which you said is less commonly used, do we know anything about any potential impact or reports of impact on sexual function?
I hadn't found any reports of impact on sexual function. What I was finding is more sort of adverse events related to cardiovascular and pulmonary symptoms like heart failure, really significant toxicity. So perhaps at much lower doses, it's being used orally, but again, just not super familiar with any reports on either positive or negative impacts on sexual function.
Okay. Now, kind of moving over to the finasteride side of the equation, can you share with us if there's any known impact reports, etc., of finasteride impacting sexual function?
Yeah, I would say that, again, some of the effects that we see from these medications are dose dependent. So at a higher dose, like the 5 milligrams for BPH, I definitely talk to all of my patients who are on finasteride from a different prescriber, or if I'm going to be prescribing it, about the potential for impact on sexual function. And I think what I quote is about a 5 to 10% chance that there's a negative impact on sexual function, including libido or sex drive, erectile function, ejaculatory function, and sexual pleasure. And this has definitely been described in the literature at the lower dose of finasteride, which is used for male pattern baldness, the 1 milligram. And these changes that can be negatively impacting male sexual function have been reported in many men and have been reported to possibly be irreversible.
Okay, well, that certainly is reason for concern. So, Dr. Heeman, have you yourself encountered or interacted with patients who have reported, erection or sexual function issues after use of finasteride?
Yeah, unfortunately, I have. I've seen this both in my older population of men who take finasteride for BPH symptoms, who experience a drop in their sex drive, maybe a drop in sexual function, even symptoms of breast tenderness can come up, and as well as my younger patients who may have been prescribed finasteride by somebody else or sought it out on one of the direct-to-consumer websites. And I have seen, cases of sort of post-finasteride syndrome where sexual function is reduced, sex drive is reduced, even more broad symptoms in terms of cognitive function, sort of feeling hazy, foggy, less motivated. I have seen that, albeit rarely. It has definitely come up.
What is the understanding, or what is the mechanism in which the finasteride is impacting the sexual function and sexual arousal systems?
Yeah, so I guess it's important to understand what DHT is as a very powerful male hormone. DHT is responsible for sexual differentiation when we're all in development, and it's responsible for seeing some of the secondary sex characteristics like penile length, health of the male genitalia, hair growth as we go through puberty and early in life as well. And so having that being reduced really can impact certain people's, those end organs that we're describing, like the penis, etc. So there can certainly be a negative impact on those end organs when we really reduce DHT. And perhaps it's due to certain individuals' susceptibility to sort of these hormonal changes. Some people may have less sensitive receptors. Some people may be just less sensitive to those kind of alterations in the hormones, that may be why some people perceive an impact and others don't at all.
Dr. Heeman, you mentioned that this may be a permanent change that people experience. Out of curiosity, would a testosterone supplement post use of finasteride, again, totally in theory, balance out the impact of, it sounds like, again, the inhibition or suppression of DHT, or is it not that simple?
Great question. I think it's probably not that simple, but I think it can certainly have a role in helping restore function for men who are experiencing post-finasteride syndrome. And there are cohorts of men out there that are in support groups and things like that who are really suffering from this and need probably a trial and error approach to some solutions. We can support better erectile function with medications like sildenafil, tadalafil. We can support sort of that more global cognitive effect by therapists, involving folks like yourself. And certainly testosterone may play a role to try to sort of boost that system. We always want to be cautious about using testosterone, especially in the younger population of men who may be considering fertility and wanting to have children, because testosterone use is a very powerful suppressor of sperm production. And so we want to be really cautious about how we can support a man's body making his own testosterone versus just taking exogenous testosterone like shots or things like that, because they have differential impact on sperm production.
Along the same lines, is taking finasteride at the same time that one is taking a testosterone supplement, is that counterproductive? In other words, are they working in opposite directions? Or can somebody be on both at once?
I think someone can be on both at once. You know, at the end of the day, when you take finasteride, it blocks the testosterone that's going to become DHT. And so you're actually sort of keeping more testosterone around and just less DHT around. So you're kind of just altering that ratio. So they can certainly be used in concert.
Okay. From your experience with patients who have reported being impacted by finasteride, or at least have described some correlation, have you experienced any patients who have been able to successfully resolve these issues post finasteride syndrome?
Yeah, I would say that, I've been in practice for 5 years, and I have seen probably two patients with sort of a young patients with post-finasteride syndrome. And unfortunately, it's sort of a diagnosis of exclusion because there could be other things, these sort of symptoms of low libido and ED can be related to other life stressors, other sort of changes that have occurred. And of course, we want to be acknowledging the patient's experience of having taken this medication and seeing these changes. So, but we also want to be sure that we kind of get the whole gist of what's going on with each patient. In these two patients, I think it's really important to get a multidisciplinary team of providers that can be helpful from kind of all of these aspects, like I mentioned. And I can't say, longitudinally, as urologist, I don't necessarily drive the focus care on that, but certainly I can sort of be one of those team players to help with the erectile function, help manage testosterone, and then kind of take it from there with the whole rest of the team.
Okay, in other words, you're saying a patient who comes to you is really coming to you with a primary complaint around penile function, sexual function, and whatnot. You're not really managing the hair loss side of the medication, although this probably would come up if particularly say a younger patient was on finasteride for BPH. This might be a concern.
Yeah, absolutely. I would say it's rare for me to come across a young patient that's on high dose finasteride, but I would usually recommend that they not be on that because first, there's really no indication for young men to be on that type of therapy, but just to avoid any potential side effects as well.
In your opinion, where might there be some psychological or psychogenic overlay here for patients who either are on or are experiencing a post-finasteride, impact or syndrome?
Yeah, I mean, I think that's what I was sort of alluding to is that it's really incumbent upon us as providers to get a comprehensive view of what's going on with a patient because certainly some of the symptoms they may be experiencing, like low sex drive, depression, things like that, may come from other reasons besides finasteride, but there is a true condition here, the post-finasteride syndrome, and then that can certainly lead to these symptoms, and it can really be a phenomenon where it builds upon itself. And so we want to be really careful to try to make sure we are comprehensively taking care of patients. And again, that just sort of goes back to that team approach I was talking about, where what we engage with providers like yourself, we engage with, providers from AASECT, sort of sex therapists, and folks who can really comprehensively address some of the mental health concerns that can arise from post-finasteride syndrome.
How quickly would a patient expect to see an impact if they are among that group that is susceptible? And what should the response be? Should a patient immediately consult their prescriber? Should they wait it out for a little while? What's the best way to approach this?
It's interesting because finasteride is a medication that's really slow working. So when we prescribe it for BPH, for instance, we tell patients that they will not see the real full result of that medication for 6 full months. So it really takes a long time to ramp up in the system. In my impression from sort of the literature, I've heard that this post-finasteride phenomenon can occur sooner than that. And my recommendation would just be to stop the medication. Just stop it. There's no danger in stopping it, but you can stop it right away. Let your provider know, kind of talk about what you're experiencing and seeing how, any recovery might be facilitated right away.
Given that finasteride seems to have at least a risk of sexual side effects, and Rogaine, again, from your research and whatnot, and you have not anecdotally heard of anybody with these complaints, there must be a reason that people would choose to use finasteride over minoxidil. I'm not sure if this is outside of your wheelhouse, but it certainly has me curious
Yeah.
as to why one would choose one of these over the other.
I also am curious, Mark, because if I were to make any recommendations to my patients, it would definitely be more towards the minoxidil side. As you mentioned kind of in the introduction, I also see men for male fertility evaluation and male infertility concerns, and finasteride has some impact on male fertility, mostly just in semen volume. So it can reduce semen volume. And so from that aspect, I also sort of just don't favor finasteride as a drug. I don't really typically prescribe it often for my older patients either. And I know a lot of us in sexual medicine just think of it as sort of a dirty drug, and we just don't prefer using it when there are other good options to achieve the desired effect of hair growth or, treating BPH.
Yeah, so I'm sure somebody will leave in the comments for this episode will, I guess, weigh in as to why that is. I would assume that there are people that either do not respond as robustly to Rogaine as they do, or minoxidil, I should say, as they do to finasteride. There probably is a driving reason that people would have to take this calculated risk as opposed to using a safer option, as well as possibly other side effects of minoxidil that we are not really covering here because it would be outside of the purview of talking about the sexual impact. So to just kind of bring this episode to a wrap, if somebody needs to be on finasteride, what would be your advice to them if they have concerns or hesitations about potential side effects, but this really is necessary for their health, especially Dr. Hehemann coming from somebody like yourself who said, I prefer to not prescribe this drug when possible. What would you say to a person who really does need to be on this medication?
Well, that's a tough question because I think overall there is no need to be on it. I think that these minoxidil and finasteride are often used in combination because, especially in the United States, more is better. So we're always trying to tackle things from multiple domains, and male pattern baldness can be really impactful for men who are experiencing it. It can drive anxiety and body dysmorphia and, less confidence. I would just say bald is beautiful. That's my personal opinion. But that's not what every guy wants to hear, of course. I think that it's just important to weigh the risks and benefits and talk with the provider who may be prescribing these medications about the risks and benefit before trying to start it.
Okay, well, Dr. Hehemann, this has been very, very helpful, very informative. A lot of our listeners ask about these medications in particular. Post-finasteride syndrome has come up multiple times. I'm glad that you've been able to weigh in and help our listeners understand just a little bit more about some of the risks of these medications. So once again, thank you very much for your time.
Happy to be here. Thanks so much, Mark.